Hey everyone, today we're answering a common question. Why is my period blood watery and pink? If you've noticed that your menstrual blood looks lighter than usual, maybe more diluted or a pinkish color, it can be surprising or even a little concerning. But let's talk about what it actually means. First, let's start with what period blood normally looks like. It's usually a shade of red, anywhere from bright to dark, and can vary in consistency depending on the day of your cycle. But when it appears watery and pink, it usually means one of two things. Your blood is mixed with cervical fluid, or your flow is lighter than usual. This can happen for several reasons.
One common cause is that you're either at the very beginning or very end of your period. In these phases, the flow tends to be lighter, and there's often more cervical mucus present. When that mixes with a small amount of blood, the result is a watery, pinkish discharge. That's totally normal. Another possibility is low estrogen levels. Estrogen plays a key role in building up the uterine lining. If your estrogen is lower, which can happen if you're approaching perimenopause, have recently come off hormonal birth control, are underweight, or are dealing with high stress, the lining may not build up as much, and the bleeding can appear lighter and pinker. It can also happen if you're spotting rather than having a full period. Spotting is any light bleeding that occurs outside of your normal menstrual flow, and it's often pink because there's less blood and more fluid mixed in. This might happen due to hormone fluctuations, ovulation, starting or stopping birth control, or stress-related cycle disruptions. Another thing to consider is pregnancy-related bleeding. In early pregnancy, some people experience what's called implantation bleeding, which can be pink or light brown. It's not a period, but it can be mistaken for one. If there's a chance you could be pregnant and your bleeding is unusually light or off timing, it's a good idea to take a pregnancy test or check in with your doctor. And finally, if watery pink bleeding becomes frequent or is accompanied by pain, irregular cycles, or other unusual symptoms, it's important to rule out conditions like cervical polyps, uterine fibroids, or infection. While these are less common, it's worth getting checked if something doesn't feel right for your body. So in most cases, watery pink period blood isn't anything to worry about, especially if it happens at the start or end of your cycle. But if it's happening often, feels unusual for your normal flow, or comes with other symptoms, it's a good idea to get it evaluated by your healthcare provider.
If you found this video helpful, don't forget to like and subscribe. And if you've noticed changes in your period color or flow, feel free to share your experience or ask questions in the comments. You are definitely not alone. Thanks for watching and take care.